All right. Good evening, everybody, and thank you so much for joining us on this pause in the weather of rain Wednesday night, where we're glad the weather could cooperate a little bit with us tonight. We're glad that you are here joining us this evening. My name is Michael York, and I'll be your moderator for this webinar. And if you do have any questions throughout tonight's webinar, go ahead and put those in the chat or the question and answer function down below. We'll go ahead and address those at the very end of tonight's presentation, just in case any of those questions do happen to be addressed throughout tonight's presentation. We do ask that you refrain from using the hand raising tool. Sometimes it can be a little bit quirky and it kind of interrupts the flow. So the question and answer function and or the chat feature down below will be perfect for submitting those questions at the very end of tonight's lecture. We do have a great topic on hand presented by a wonderful doctor, and that is the basis of LASIK, presented by our very own Dr. Ashraf Ahmad. Dr. Ahmad does cornea, cataracts, and refractive surgery specialist here at Harvard Eye with us and has an extensive knowledge on tonight's topic. So we're very glad that he can join us this evening. Just before we get into it, a little bit of background information on Dr. Ahmad. He completed his Bachelor of Science at Kent State University and his medical degree at Northeast Ohio Medical University, after which he conducted his ophthalmology residency at Case Western University, where he served as the chief resident and awarded the most exemplary resident award. He then moved to California to complete his fellowship training in cornea and refractive surgery at the highly regarded Gavin Herbert Eye Institute at UCI. And we couldn't let him leave the state. And so we asked him to join us. I'm very happy to have him as part of our family here at Harvard Eye. So without further ado, I will pass things along to Dr. Ahmad on his presentation on the basics of LASIK.
Thank you very much, Michael. I appreciate the introduction. And thank you to everyone who's joined us tonight. I'm really excited to have this opportunity to talk about laser vision correction in general, and specifically LASIK and PRK. And as far as the agenda for today's talk, initially, we're going to talk about what laser vision correction is, what can be corrected with laser vision correction, whether that's LASIK or PRK, who is an appropriate candidate for LASIK or PRK, who is not a candidate, what to expect preoperative to surgery, what to expect during your procedure, what to expect after surgery. And then we'll end with a segment of frequently asked questions, and we'll open it up to the audience at that point. But feel free to type your questions away. Michael's going to help us field those, and we'll be sure to address as many of those as possible tonight. So let's go ahead and jump right in. So what is laser vision correction? Essentially, that's sort of this umbrella term that refers to a refractive surgery where we change the shape of the cornea using lasers. If you currently wear glasses or contact lenses, your corneas are not focusing the images and lights on the retina. So they're actually focusing the images either in front of the retina or behind the retina. And that's why things appear blurred when you're not corrected. And the goal of laser vision correction is really to change the shape of the cornea so that those images are focused directly on the retina to give you that nice crisp vision. And the most common procedures that are commonly performed are LASIK, which most of you are probably familiar with, and PRK. There are others, but we're going to focus on those two here tonight. And the goal of both of these procedures really is to get you functional throughout your day without the need for any glasses or contact lenses so that you can go about your day without that burden. So what can be corrected by laser vision correction? Well, nearsightedness or myopia, farsightedness or hyperopia, and distortion or astigmatism. And we're going to get in depth into each of these here momentarily. So for nearsightedness or myopia, that is basically when your vision is better at near and distance seems blurred. And essentially the reason why this happens is your cornea is overpowering and it's focusing the image in front of the retina. So the images that are far away are going to be blurred, and the images that are up close are going to be at some focal point crisp. Farsightedness is the opposite of that. It's also known as hyperopia. It's when your distance vision is sharp and your reading vision is blurred. And in some cases, even the distance vision is blurred in hyperopia. And this typically worsens with age, and it's basically a result of your cornea being underpowered. So essentially, the cornea is focusing the image at a point behind the retina. So most images are going to appear blurred in these patients. The other thing that we can see in patients is astigmatism, which is when your cornea is shaped more like a football than it is a basketball. And that results in multiple focal points being reflected onto the retina. And so images appear blurred, elongated, just not crisp. You may notice, especially at night, lights appear elongated. And so this can actually occur, it can occur by itself, but it's more commonly to occur in combination with nearsightedness or farsightedness. And the nice thing is we can target all of these during your LASIK or PRK procedure. Now, as far as what laser vision correction options we have here at Harvard Eye, mainly we perform two procedures, and that's LASIK, which stands for laser in situ keratoamiliosis, and the second is PRK, which stands for photorefractive keratectomy. And we're going to give you a little bit of a crash course on both of these procedures so that you know and sort of have a better understanding of which may be more suitable for you. And so again, just to reiterate, the goals of laser vision correction is to get you functional throughout your day-to-day so that you don't need dependence on glasses or contacts, so that you're able to drive a car, to go shopping, to work out, to work without the need for any correction. And, you know, if you do undergo laser vision correction and you have a little bit of prescription left over, or down the line you develop a residual prescription, you can have an enhancement or a touch-up done. Now, as far as LASIK at Harvard Eye, what sort of software do we use? We use the iDesign platform, which actually takes more than 1,200 personalized measurements of each eye. And based off of those measurements, it gives us a customized pattern that's specific to each individual patient. So no two patients are alike, no two eyes are alike, in fact. We also use laser to create the flap rather than a blade. And the laser platform that we use to create that flap is the Intralace, which is based here in Irvine. So it's sort of nice to have that in our backyard here. And the actual reshaping of the cornea, we use the excimer laser, the VisX, and that uses custom wavefront optic technology. So it's one of the latest technologies available on the market to give you guys the best outcomes. And as far as the range of correction that can be corrected with laser vision correction is for myopia or nearsightedness, that's 12 diopters. For hyperopia, it's 6 diopters. And for astigmatism, it's 6 diopters. And so if you have your prescriptions at home, and you look at each eye, there's going to be a set of numbers. The first number, if it's a minus, that means you're nearsighted or you're myopic. If it's a plus, that means you're hyperopic. If there is a second number, that means you have astigmatism. And so not everybody's going to have that second number. And that's going to tell you the magnitude of your astigmatism. Now, going back to the flap creation, again, we use the femtosecond laser to create the flap. So we don't use the microkeratome or a blade to create the flap. That was sort of outdated technology at this point. We use the laser mainly because it minimizes complications. It's very, very precise. It's highly repeatable, and it's a lot more comfortable for the patient. And so there are a lot less issues that we as surgeons and you as patients face when we use these lasers rather than the blade. And so when we use the laser, we're reducing the amount of tissue distortion, we're reducing the chance of damage to nearby structures. It's very, very, very precise, highly repeatable, and it's a lot more comfortable for the patient than the blade used to be. Now, as far as the excimer laser, which this is the laser that we use to do the ablation or the changing of the actual shape of the cornea, it's very, very precise. And so when we sort of step back and look at the amount of tissue that we're changing in the cornea, it's actually less than the thickness of a human hair strand. And so that in itself sort of speaks to the amount of precision that's required in this technology, and the precision that we need in order to get the best outcomes. Now, as far as the procedures themselves, we're going to kind of talk a little bit about LASIK and PRK here and the differences. When we do LASIK, the first step, so we're going to use 2 lasers when we do LASIK. The first laser is going to actually create the flap, and then the surgeon goes ahead and lifts the flap, which you can see in the image labeled number 2 here. Then we use the second laser to do the ablation, which is the changing of the actual shape of the cornea. The surgeon then lays back the flap, and the procedure is complete. So it's relatively streamlined. And, you know, if we decide that we're doing both eyes, we do the second eye right after we've done the first eye. With PRK, it's very similar to LASIK with one exception. We actually only use 1 laser, so there's no flap involved. So rather than using the laser to create a flap, we actually do a scraping of the surface cells of the cornea. Then we do the custom ablation pattern. And then you actually go home with a little bit of a contact lens that's there to serve to expedite healing and to provide comfort for you as well. Now, again, the PRK procedure it's the same exposure pattern that you're getting in LASIK, but we apply it to the surface rather than under a flap. And we mainly reserve this for lower levels of correction for patients who have thinner corneas. So this is sort of what we go to if you're a borderline candidate for LASIK, you're probably a better candidate for PRK. Now, the pros and cons of each. For LASIK, the pros are basically rapid healing. So generally within a day or two, patients are back at work. They're doing what they normally do. There's less discomfort with LASIK. You can expect to have some foreign body sensation, but no true pain. And your best vision comes in a little bit faster than it would with PRK. There are some negatives, and the cons are once you have the flap created for LASIK, you have that flap with you for life. And so if you have, God forbid, significant trauma down the line, that trauma can cause issues with your flap, like dehiscence or dislocation. But the chance of that happening is very rare, except in rare instances. Dry eye can also be an issue. I always tell my patients that you are likely to experience dry eye at some point in your postoperative period. And so it's best to identify dry eye beforehand and treat it aggressively. Regardless, I always like to put patients on lubrication going into the procedure, and that way that's something that we continue afterwards. For patients who do develop dry eye, it generally resolves between 6 months to 1 year. There's a very, very small subset of patients where it lasts a little bit longer than that, but generally we expect resolution within that time period. For PRK, there are some pros, and that is you don't have a flap. So patients who are in high contact sports or are boxers, we don't want to give them a flap because that puts them at risk for having issues down the line. And as I mentioned previously, it is suitable for patients who have thinner corneas that are not safe to undergo LASIK. There are some downsides to PRK. The healing process is a little bit longer than it would be for LASIK. So generally expect about a week to 1 month of healing. There is a little bit more discomfort after surgery because we've essentially, when we scrape off those cells, we give you a little bit of an abrasion. And that's why you go home with a contact lens, again, to help expedite the healing process and to provide some comfort. Best vision, we generally say about 1 to 2 months before you kind of get your best vision. And dry eye can still happen with PRK, but it is lower incidence when compared to LASIK. So that's something to also keep in mind. Now, what if you're a patient who is in your 40s or 45 and you're beginning to lose the ability to see up close, meaning you're starting to rely on reading glasses or cheaters to see up close? When these patients come in, we sort of have to think a little bit differently, because if we were to do LASIK and both eyes were set for distance, then there's definitely going to need cheaters for up close work. So for these patients, we sort of start thinking about something called monovision, where we set one eye for distance and the other eye is set for near vision. And when you have both eyes set at different focal points, they kind of work together when they're both open to give you a nice range or blended vision. We always like to do a contact lens trial prior to doing monovision. That way we make sure your brain is able to tolerate that difference. And a lot of these patients really like it and they do well with it. There are some downsides to monovision, and those downsides are you lose a little bit of your binocular vision because now the eyes are working at different focal points. You lose a little bit of depth perception as well for the same reason, and contrast sensitivity may be reduced as well. But overall, these patients who are able to tolerate the contact lens trial do very well when we do it surgically with LASIK or PRK. Now, some common issues or complications that can happen with LASIK or PRK, one of them being over and under corrections. So it is uncommon for that to happen, but when we do see it, we like to correct it. And generally, when we do see some residual prescription left, we want to make sure, one, the dry eye, if it's present, is treated, and two, we want to make sure your prescription is stable before we go back and decide to do an enhancement or a touch-up. So if we do see a residual prescription, we can touch it up. The other things that we can see, one of them being halos and glare. That used to be more of an issue with the older generation models of lasers. Now with the third generation lasers, it's much less of a concern, but if it were to happen, it's mostly at night and around lights. Dry eye is also an issue, which I sort of spoke about recently. And generally, as I said, most patients within 6 months to a year have resolution. There are the very small subset of patients that will have it after that. And again, it's really, really important to identify these patients ahead of time so that you can treat it aggressively beforehand and continue that treatment afterwards. So again, pre-existing dry eye can be a common thing that we see, and it can be exacerbated by LASIK. So that's the main reason why it's important to identify those patients and treat it appropriately. Now, are you a candidate for LASIK? So an interesting factoid that sort of came from the whole COVID pandemic was there was a huge rise in the demand for refractive surgery, LASIK or PRK, and that actually stemmed from the issue of fogging with glasses while you're wearing the mask. And so we saw a really huge spike in the demand for LASIK. And so that's why this talk is sort of relevant at this point. Now, when you come in for your LASIK consultation, the goal of the exam is to make sure your corneas and your eyes are healthy enough to have LASIK and stable enough to have LASIK. And so when you come in, you should expect a very comprehensive exam. We check your glasses prescriptions, we look at your cornea, we check your corneal maps, we do corneal thickness measurements, we check the size of your pupil in dim and bright conditions to make sure you're a good candidate for LASIK. And we'll go through many, many tests when you come in. We'll check your prescription time and time again, and we'll do very sophisticated corneal maps to make sure that your corneas are healthy enough to undergo the procedure. Now, not everybody that comes through the clinic asking for LASIK is a good candidate for LASIK. So what things may preclude you or make you not an ideal candidate for LASIK? Well, one of those things is if you had a history of herpes virus in the eyes, we risk reactivating that virus if you were to have LASIK. And so those patients may not be an ideal candidate. Anybody who's had prior RK or radial keratotomy, we want to avoid a LASIK flap in these patients, so you may not be the best candidate. If your prescription has not been stable or it continues to change, we definitely want to wait until it's stable. And generally, we don't want to see more than a half diopter change in the last year. That's what we consider stability. If you've had a lazy eye as a kid, laser or LASIK will not fix that. So that's something to keep in mind. If you form keloids or you're a poor wound healer or you have scar formation, we want to know about that because that may impact your outcome and your healing process after the procedure. If you're pregnant, we like to wait until you're done breastfeeding because your prescription may change during that time. And so we want to ensure your prescription is stable before doing the procedure. If you play martial arts or you're involved in contact sports, we may rule you out as a LASIK candidate just for that reason. So we may consider you a better PRK candidate in that situation. If you're on acne medication like tretinoin or Accutane, we like to discontinue that prior to the procedure, mainly because it can contribute to worsening dry eye symptoms. And then if you've had a history of any autoimmune conditions, diabetes, or any immunodeficiency, we want to know about that because, again, it can impact the outcome in your healing process. Now, if you're a contact lens wearer, ideally, we want you out of those contact lenses. And mainly that's because when you're wearing contact lenses, it alters the shape of your cornea. And so when we do the LASIK procedure or the PRK procedure, we want to make sure that your corneas are back to their baseline, not what they are when your contact lenses are in place. And so if you're a soft contact lens wearer, we need you out of contact generally 1 to 2 weeks. If you're a hard contact lens wearer, we say 4 weeks, but really it's when your cornea demonstrates that it's stable. And so it could be a little bit longer than that for hard contact lens wearers. Now, what if you are a candidate? Well, then we can go ahead and safely proceed with the custom LASIK. And again, the software that we use is wavefront guided LASIK. It measures more than 1,200 points on your cornea, and it measures any aberrations that are internal in the eye as well. And then it creates a custom pattern that's specific to each individual eye. So it's a very customized, very completely custom to each patient, to each patient's unique anatomy and vision needs. Now, patient satisfaction, 95% and above for a lot of these patients. There are some, there's going to be some patients who are dissatisfied, and that stems mainly from 3 main things. One is having residual refractive error, so any need for glasses. Again, if that were to happen, we are able to do an enhancement or a touch-up if appropriate. We like to make sure that if their dry eye is present, we want to treat it. We want to make sure their prescription is stable before we go back in and do that touch-up. If dry eye develops, we treat it aggressively initially with drops. We can also do punctal plugs. We can do prescription medications. So there are a lot of options if that were to develop. And then there are some patients who will have some halos and glare at night. But again, this is much less of an issue with the newer lasers that we're using here at Harvard Eye. Now, what should you expect when you come in for your consultation? You should expect a comprehensive exam. We'll check your prescription or your refraction. We look at your corneal maps, and then I personally sit down with you and we have a thorough discussion of all your options, and we come up with a plan together. On the day of your procedure, expect to have a secondary comprehensive exam. We essentially look at all the numbers again. We do more testing on the day of to make sure everything checks out. I always say it's better to measure twice, cut once. You should expect a verification of all the measurements, expect to have a very painless experience. You're going to have anesthetic on board. You're going to have sedative on board as well. And the nice thing is it doesn't require a trip to the operating room. So everything is done in our clinic, in our LASIK suite, which makes it a little bit of an easier process to have. As far as recovery, for LASIK, it's a very quick recovery. As I mentioned previously, you're back to your baseline generally within 24 to 48 hours and back to work within that time period as well. We like to see you the day after surgery, a week after surgery, a month after surgery, and then 3 or 6 months out after as well. PRK, expect a few more additional visits on top of that, and that's because we did the scraping of the cells, and so we want to make sure your cornea is healed. So it's a little bit longer of recovery when compared to LASIK. You go home with that contact lens, which we remove a few days later. And then we see you a little bit more frequently, as I alluded to. Now, we're sort of at the frequently asked questions segment. So I'm going to go through a few that I've experienced with patients here, and then we'll go ahead and open it up to questions from the audience. So one question or one fear that a lot of patients have is what happens if I blink or move during the surgery? Well, the good news is we use an eyelid holder to keep the eyelids out of the way. So blinking is not an issue. And the second thing is the laser itself is actually equipped with iris registration and active tracking of the eye. And so if there's significant movement, the laser will actually pause the treatment. Does LASIK or PRK hurt? No, the procedure itself is painless. You have anesthetic on board. For some patients, we'll give them a sedative as well to kind of reduce any anxiety, get them calm. But the procedure itself is painless. You may have some foreign body sensation and some discomfort for the following day, but nothing beyond that. PRK may have a little bit more pain than that. How long does each procedure take? So generally, LASIK or PRK, it's about 10 to 15 minutes per eye. And, we'll do both eyes in the same setting. So expect about a half hour or so. How quickly can I go back to work? With LASIK, I generally say 1 to 2 days. With PRK, I'll say 3 to 4 days, something in that range. What happens if you're under or overcorrected? Well, if you have sort of any residual refractive error, we like to wait, as I mentioned, until your prescription is stable. And then once it is stable and we sort of ruled out dry eye as a factor, we ruled out other issues as factors, then we can go back in and safely do the enhancement or the touch-up. If you do develop dry eye, what happens? We treat it aggressively. I like to do, initially artificial tears, warm compresses. We can always do punctal plugs. We can also do prescription medication. It just kind of depends on how symptomatic you are, what your exam looks like. So each patient is individualized. And then, is laser vision correction worth the cost? When we look at the data and we look at the long-term cost of contact lenses and glasses, LASIK is definitely a lot more cost effective in the long run when compared in that way. And so for a lot of patients, it makes more sense to do it and kind of pay the upfront cost rather than over time and pay a little bit more. And so with that, I'm going to turn it back over to Michael, and we'll field any questions that have come our way, and we'll also open it up to the audience.
Yeah, the great questions are already coming in. The first of which is always the first question that comes in, and the cost. So the cost does differ depending on the type of procedure that you are getting between LASIK or PRK. Generally, what we like to quote is $29.50 per eye. Can kind of be your set expectation. That can differ depending on, like I said earlier, the different type of treatments that we do offer between LASIK and PRK and individual as well. So that does differ, but that's generally the cost and the price point we like to give out. Mm-hmm. The second question, a very good one. And correct, there are so many different vision correction options. What are your thoughts on topography guided treatments versus wavefront guided versus SMILE versus ICL?
Yeah, so again, each patient is going to be individualized.
Mhm.
What we have here is wavefront guided technology. There is topography guided as well. The wavefront guided actually also looks at the cornea. It measures 1,200 points on that cornea, and it also takes internal aberrations into account. And we've had incredible results with that. There are some places where you can get topography guided LASIK, which is also a fantastic option. When we look at outcomes of both, at the end of the day, they're very similar. As far as ICLs, that we typically reserve for patients who are highly myopic or have a very nearsighted prescription, where it's unsafe to take that amount of tissue that would be required if they were to have LASIK. And so for those patients, we have to do a little bit more testing to make sure they are good ICL candidates, because it is an intraocular surgery. So we're actually going inside the eye rather than on the surface of the eye. Smile is available at some places. We here only offer LASIK and PRK. Smile is a fantastic option. It is newer, so we don't have long-term data, but so far the patients who undergo it are very satisfied and have fantastic outcomes as well.
What about FAA compliance with regards to LASIK and PRK?
What exactly is meant by that question?
Just the comply. I mean, both compliant and easily available to all patients, correct?
Yes, correct.
Yeah.
Correct. Absolutely.
All righty. And if anybody does have future questions that do come up, and not particularly at this moment, I know I have to sit with some presentations, and then I'll populate a couple of questions the very next day. You can always reach out to us at the same email that you registered with, just our marketing@harvardeye.com, or bada bing, bada boom, on cue, Dr. Ahmad brings up the scan me. So you can always go ahead and scan that QR code. We'll leave that open for a couple seconds here. So you can go ahead and scan that and have it open for, a day or two, just in case any questions come up. You can absolutely submit your questions through that QR code, just using the cameras on your phone if you want to open those up.
Yeah. And this will also take you to our online LASIK self-test, which will give you and us a little bit more insight about what you're looking for and whether or not you're a candidate. So we'd be more than happy to look at your inquiries and take it from there.
Yeah. And we do have another couple of questions that have come up. And is there an age limit?
There is no age limit to LASIK, but generally at the age of 40 or 45, we start to think whether or not the benefit is going to be there for you. We start to think about monovision. For patients who are a little bit older, in their 50s or 60s, then we start to think about refractive lens exchange or cataract extraction rather than LASIK, because that's a better option at that point. Generally, I like to wait until the age of 21 as my first cutoff before we can consider LASIK, and that way we've given your eye enough time to stabilize and your prescription hasn't been changing.
Another good question: do cataracts get in the way or preclude you from getting surgery?
Cataracts do not get in the way. However, for patients who've had LASIK and are undergoing cataract down the line, cataract surgery, the LASIK procedure can affect our calculations. And so it's really important for your cataract surgeon to know that you've had LASIK, so that we can take that into account when we're figuring out which lens is best suitable for that eye.
Do we offer refractive lens exchanges?
We do offer refractive lens exchanges. Dr. Hovanesian, Dr. Kirsten, and myself all do them.
Wonderful. And it does look like that is all the questions that we have for tonight. And once again, feel free to go ahead and scan that QR code or email us at that marketing@harvardeye email account, and we will be happy to address your questions, even if they come up in the following days. And if you're wondering, oh, you know what, there was something great that Dr. Ahmad said that I wanted to revisit, we do have this on recording, and we will be sending it out to all of you. So we will be sending a copy. It will be a link to our YouTube page as well, so you can go ahead and view that and a lot of the other great content that we have on there as well that go about many different subjects with regards to ophthalmology. So before we sign off for tonight, Dr. Ahmad, any closing remarks?
I mean, I look forward to seeing you all in the clinic. And this is really an exciting time to be a patient, to be an ophthalmologist. And thank you all for your attention and for attending tonight's webinar.
Yeah, we appreciate you all. We appreciate you spending your Wednesday evening with us. And we appreciate you joining us and the whole Harvard Eye team. On behalf of Dr. Ahmad and myself, we wish you a very wonderful evening. Take care, you guys.
Good night.